Dear colleagues, ladies and gentlemen, good evening. I'm going to speak to you about a new tool of advanced analysis, which is Metabolomics, as a tool to be used in personalized medicine. So I'm going to talk to you today about precision medicine, which is a better term for personalized medicine, as we'll see, about how this can be used in chronic diseases and how help us to intervene with modifiable risk factors, about metabolomic analysis, and I'm going to present to you our experience in addressing autoimmune and chronic diseases. So personalized medicine, individualized medicine have been used in the past, but since each treatment is personalized and individualized, precision medicine is a better term for the ones we've used up to date. So precision medicine is the innovative approach that takes into account the individual differences of people, which are based on genes, environments, and the lifestyle. So until now, we were used to treat the average patients, and while this was successful for some patients, it was not for others. So evidence-based medicine should be complemented with precision medicine, and they should be viewed as complementary to have the best results. The goal of precision medicine is to target the right treatment for the right patient at the right time. So the information we use to perform precision medicine is based on genome sequence, microbiome composition, the health history, lifestyle, and diet, and results of metabolomics. So precision medicine is not something new, it's the combined application of all what we know. 90% of mortality worldwide, especially in developed countries, is due to chronic diseases. And this, based on the World Health Organization data, is due to modifiable risk factors connected to lifestyle and diet. So while genetics is the cause factor for about 20% of chronic diseases, the rest is modifiable and we can act upon it. This is the human metabolism, and lifestyle, diet, nutrition, obesity, and all the factors that are related to our lifestyle, they share common metabolic pathways. So metabolomics is the most reliable tool. There are analyses that can be performed to blood, urine, and other liquids of the body, and can measure small molecules and can give us the information about the phenotype. Phenotype is what we see, what's the end product. So while genomics can tell us about what can happen in a human organism, metabolomics can give us information about what has happened and what is happening right now. So the metabolism is the end product of the interaction of the microbiomes with the genes and the drugs, the diet, the lifestyle, and the environment. And this is a metabolic pathway. These are small molecules which are called metabolites. And metabolomics is measuring them, and is the science that can find blocks in these metabolic pathways. So we can have information about what is happening within the body, and we have info about the functional need for nutrients or the effect of drugs in a patient. For example, in autoimmune diseases, we can study the metabolic pathways in order to, in different diseases, in order to have information about the pathogenesis, the cause of the disease itself. Autoimmune disease is the #1 cause of chronic disease today, and they are connected with the lifestyle, the overnutrition, the changes of the microbiota, especially in developed countries, and the metabolic pressure that comes with increased daily caloric intake from processed foods, industrialized foods with high in sugar, high fat, high salt, which hyperactivate an immune response, and the lack of immunomodulating nutrients like omega-3, vitamin C, probiotics, and vitamin D3, which cause an imbalance and we have autoimmune diseases. So based on metabolomics analysis, we can give personalized health, which is based on individualized nutritional regimens, detect and correct nutrient deficiencies, and also optimize pharmaceutical treatments for the need of each patient. So metabolomics can allow the medical doctor to almost immediate clinical impact and deliver personalized medicine. And with our experience and application within the last 10 years, we have performed more than 40,000 metabolomic analysis studying key metabolic pathways, and 60% of them were mostly suffering from autoimmune diseases like Hashimoto, like inflammatory bowel disease, like rheumatoid arthritis, psoriasis, atopic dermatitis, or multiple sclerosis. So metabolomic analysis was performed in these patients, and we've seen that many of these autoimmune diseases and these patients, they had common metabolic imbalances like dysbiosis, which is an imbalance in the microbiome. We had mitochondrial dysfunction, almost a universal lack of vitamin D, and altered fatty acid levels, which was mainly due to the unhealthy dietary patterns of the patients. So patients were provided with personalized care plan, and dietary interventions and lifestyle instructions were complementary to any medications that were given to restore nutritional deficiencies. So in our patients, over 85% of our cases, they experienced a markedly improvement in their health, and most patients experienced reduced disease symptoms, dampening of drug side effects, and the gradual reduction of the disease burden. Some of them had a complete remission of their symptoms. So to conclude, metabolomics can assess the effect of modifiable risk factors in the development of chronic diseases, and we can facilitate prevention, assess the metabolic condition of patients, and allow doctors to deliver personalized medicine treatment. Thank you.
Tsoukalas Δημήτρης.
Είστε?
Είμαι γιατρός, είμαι επιστημονικός διευθυντής της Metabolomic Medicine Switzerland και έχουμε κλινικές στην Ελβετία, στο Μιλάνο, στη Βενετία και στην Αθήνα.
Θα ήθελα λίγο να μου πείτε ότι εσείς βρίσκεστε στην Ελλάδα, βρίσκεστε στο εξωτερικό κυρίως.
Ναι, βρίσκομαι και στην Ελλάδα και στο εξωτερικό. Έχουμε μια ομάδα από γιατρούς, επιστήμονες, διατροφολόγους, βιολόγους, βιοχημικούς, εργαστήρια και δίνουμε υπηρεσίες που έχουν να κάνουν με προχωρημένες, προηγμένες αναλύσεις που μετράνε πολύ μικρά αμόρια μέσα στον οργανισμό και βρίσκουμε την αιτία γιατί κάποιος δεν είναι απολύτως υγιής. Αντιμετωπίζουμε κυρίως νοσήματα που είναι χρόνια, όπως είναι τα αυτοάνωσα νοσήματα, όπως είναι ο διαβήτης, όπως είναι η θηροειδίτιδα Χασιμότο που είναι πολύ συχνό πρόβλημα, ο διαβήτης, η ελκώδης κολίτιδα, η σκληρής κοιταπλάκας.
Ουσιαστικά μεταλαμπαδεύετε τις γνώσεις σας και στο εξωτερικό, δηλαδή είσαστε από αυτούς που τη δικιά σας την τεχνογνωσία τη βγάζετε έξω.
Ναι, είναι αλήθεια. Αυτό που κάνουμε είμαστε πρωτοπόροι στην εφαρμογή, είναι μια επιστήμη των Omics, πως είναι η Genomics, Metabolomics, μετράμε μεταβολίτες, πολύ μικρά αμόρια και είμαστε πρωτοπόροι παγκόσμια. Έχουμε κάνει πάνω από 40.000 αναλύσεις σε πάνω από 15.000 περιστατικά τα τελευταία 10 χρόνια με εξαιρετικά αποτελέσματα στο να βοηθήσουμε ασθενείς που έχουν χρόνια νοσήματα, όπως τα αυτοάνωσα κυρίως, όπως είπα.
Οπότε δηλαδή ένας λόγος παραπάνω για να προσελκύσετε ταξιδιώτες του τουρισμού υγείας στη χώρα.
Πράγματι, έχουμε ασθενείς που έρχονται από όλο τον κόσμο. Από την Αμερική, από το Ηνωμένο Βασίλειο, από τη Γαλλία, από τη Γερμανία, το Βέλγιο, από την Ολλανδία, από την Ελβετία, από την Ιγυρία, από την Αυστραλία, από την Ινδία, από την Κορέα.
Από παντού.
Ναι, έρχονται ασθενείς από όλο τον κόσμο σε εμάς.